Thank you, Madam President. Colleagues, I want to make just a few comments very briefly. The Senate continues to monitor the coronavirus situation as it evolves. We have had meetings this week, as you know, to update all of you. In addition to protecting the public's health, we want to ensure that Californians approach this situation with clarity and with calm. As you've heard, California public health officials have issued an updated policy on certain gatherings that should be postponed or canceled until at least the end of March. Their guidance affects non-essential large gatherings, small gatherings where space for social distancing is unavailable, and gatherings of individuals who are at higher risk for severe illness from the coronavirus. As I join the governor in urging Californians to follow this updated policy, I'm also aware of the impact it has on our own work. For those of us, or for those who have asked, a switch to remote legislating is not an option at this time. But we will be taking the next few days to do a hard evaluation of how to proceed within the new public health parameters. We're also working with the governor and the Assembly to figure out ways to assist workers, small businesses, and families who find themselves harmed economically by necessary efforts to mitigate the coronavirus. No one should pay a price for doing the right thing and protecting the lives and the health of others. I personally want to acknowledge our appreciation for the Secretary of the Senate, who obviously is busy doing the work that we have tasked her with, and her incredible staff, who are working around the clock, I assure you, to review and plan for how to best conduct our critical public mission. As we develop the path forward, we will continue working to assess risk and accommodate individual situations. We will be sharing resources announced by both the federal government and the state of California via our websites, our offices in support of communities, and particularly our business community and small businesses. And I really have to say how much I appreciate the hard work of the governor, the Office of Emergency Services, the California Health and Human Services Agency, and the Public Health Department, who are working to keep us all informed as quickly as they are able to do that. So please continue to route specific questions about the legislature and the Capitol through my office or the Secretary's office. And let me just add here, colleagues, rumors do not help. If you get a piece of information you are concerned about, please call the Secretary's office or my office and let us give you the accurate information. We are responding to every comment, every issue, but we want to do it appropriately. So I would ask you, please don't spread rumors. Call the office if you hear something you're concerned about and let us run it down, track it down, and react and respond to you. I want to thank you for that suggestion, Senator. And finally, I want to express my gratitude to every single one of you for coming together as we all continue to work to assure the health and well-being of our constituents, our staffs, and our families, and of all of our colleagues. This situation remains very serious, and it remains very fluid. It is not what any of us would hope to see, but is certainly the challenge before us right now, and I am certain that we can rise to the challenge and to this occasion in a way that is appropriate, that is calm, and that takes the facts and the data into consideration. As Clara Barton, the founder of the American Red Cross, once said, "You must never so much think as whether you like it or not, whether it is bearable or not. You must never think of anything except the need and how to meet it." Colleagues, I hope you have a good weekend at home with your families and your constituents. Take the rest that you need now more than ever to get the appropriate amount of rest to be able to tackle these challenges is what we need. And I will see you on Monday, March 16th, 2020 at 2 p.m. Madam President, thank you.